Welcome everyone. Bienvenue à toutes et à tous. I am with Media Relations Team at Health Canada. The event will begin shortly. Je suis avec l'équipe de relations avec les médias à Santé Canada. L'événement commence sous peu. If you wish to ask a question on Zoom, please use the raise your hand function and I will read the questions in order. Please modify your Zoom handle to reflect your name and media outlet. Si vous désirez de poser une question, veuillez utiliser l'option de lever la main. Je vais essayer de prendre les questions dans l'ordre. Veuillez modifier votre nom dans le Zoom pour indiquer votre nom et votre média. D'accord, merci pour vous patienter. Thank you for your patience.
It is my pleasure to join you here today on the traditional and unceded territory of the Algonquin and Anishinaabe people for today's event. My name is John Heckbert, and I'm the Executive Director of Operation Come Home. Very happy to welcome you here this morning, and it's my honor to introduce Minister Carolyn Bennett, Minister of Mental Health, Addictions, and the Associate Minister of Health for the federal government. Minister Bennett was first elected to the House of Commons in 1997 after working as a family physician and assistant professor in the Department of Family and Community Medicine at the University of Toronto. You may know her best as the former Minister of Crown Indigenous Relations and a passionate advocate for reconciliation among First Nations, Inuit, and Métis people. Minister Bennett has spent much of her medical and political career working to improve the health of Canadians by focusing on the social determinants of health. Those social factors, such as income, education, and other things that help determine one's overall well-being. Ladies and gentlemen, please join me in welcoming to this stage Minister Carolyn Bennett.
Thanks, John, and hello, everyone. And before we begin, I too want to acknowledge that we're gathered here on the traditional and unceded territory of the Algonquin and Anishinaabe people who have stewarded these waters and these lands for the time immemorial. Thank you, John and Katie, for welcoming us here this morning and for a really, I think, interesting and inspiring conversation about really everything that happens here at Operation Come Home. And it is, I think, important, for people to understand what's really happening behind the scenes, that when we see people who are without housing or on the street, that they know that there are amazing organizations like this that are working every day to make their lives better and to get them on a good path. And so it is, I think, just talking with Katie to understand that people who aren't housed or young people are at much greater risk of substance use. And I think that the kind of programming that you're doing here with the outreach to people at risk of substance use, but who are using, and for you, I think, to really demonstrate the importance of peer supports and people with lived and living experience is part of that team that makes it safer and reduces the barrier to people actually being able to ask for help. And I bring and greetings and thank my colleague MP Yasser Naki, who is, I know, a great friend of this organization and really wishes he could be here with us this morning. This is National Addictions Awareness Week and National Housing Week, actually. And so it is the intent for all of us when we have these weeks where we focus on the solutions. That really is about helping to address those with substance use or problematic substance use or other issues around that are complex, and housing being very much part of that, as you said, John. This year for National Addictions Awareness Week, the theme is a community of caring, and I think that we all know that people using substances way too often feel vulnerable, isolated, and judged. And we know that all Canadians have a responsibility to change that people actually need to feel that they can reach out and have a conversation about their use of substances or just struggling with mental health and sometimes using substances to numb the pain. Le Canada traverse actuellement la pandémie parallèle de la crise de surdose et d'un approvisionnement en drogues illégales toxiques. Des milliers de personnes sont mortes. These are family members, colleagues, friends, and neighbors. And as we've heard, that as Katie said, that to have people who are friends and people you know and love and serve are gone. And so I think a lot of us were upset last week to see the video that the leader of the opposition posted with truly untrue information about harm reduction and safer supply amid this crisis. We see that is just upsetting because it is about the stereotype. It's increasing the stigma. It just is so unfair. And I think that as all of us know, when you meet with stakeholders and experts, but particularly those with lived and living experience, and also, your counterparts across the country, our counterparts across the country, that it is about how do we discuss reducing substance use harms, preventing overdose, and reducing the stigma towards people that are using drugs. Nous avons collectivement un objectif, contribuer à sauver la vie des Canadiens, and it is the theme of this week, creating a caring community that actually that understands. And so we know that we need a multifaceted approach to this crisis, but it has to be based on the 4 pillars that are internationally recognized, which is of drug policy. Prevention, which you are doing in your outreach, harm reduction, which you're doing in the kinds of referrals you make, the kind of treatment that you make available to people, and we know that there still needs to be enforcement, particularly for the people preying on young people on the street, and that we want that stopped. I think all of us this week are being reminded of the what happened for the decade where harm reduction was removed as one of the pillars, that the 3 pillars on their own are not enough, and that was just based on ideology instead of science. And so we are continuing to work hard to build up the supports to save lives, because after that very long time of failed policies, or the refusal actually to put policies in place that were evidence-based and known to work and save lives. Puisqu'il n'y a pas de modèle de guérison pour les personnes qui sont décédées. I think it's been almost 20 years that I've been saying you cannot help people who are dead. You actually have to meet people where they are. And I think just being here knows that everybody we've met here, that it is about a trusting relationship which meets kids where they are, and where with dignity and respect, and where they have a sense of agency in terms of that they are creating the environment that they need and that will help others. So I think that it is really important for us all to understand, there's not a single answer to ending the overdose crisis, but we know that things like safer supply are an essential element to reduce hospitalizations and ambulance visits and the visits to the emergency department, that saves lives. And I think that as you make your referrals to safe consumption sites, we know that there are provinces that are refusing to fund those, and we know that is exactly what the Leader of the Opposition has been saying. For us to know that 42,000 overdoses have been reversed in safe consumption sites, that's 42,000 people that are our sons and daughters and friends and loved ones, and without one death in a safe consumption site. So. Je pense que la conversation que nous avons aujourd'hui est opportune. What we have to explain to all Canadians that if we treat people living with addiction with compassion, respect, and empathy, that is the way that they can get to live their best lives and to get on a good path. And I think that what you've demonstrated here, where it's housing or employment or education, that and the fact that there are some people who will still be using drugs, but that they're not rejected, that they are helped, and they have people they can talk to, they trust. So aujourd'hui et chaque jour, j'encourage chacun d'entre nous à faire partie de cette communauté en faisant en sorte qu'il soit plus facile pour les gens de parler de leur dépendance ou des autres luttes qu'ils peuvent avoir avec des substances. Because we have seen that the stigma towards people who use substances causes many to hide their use or avoid seeking help, even if they feel they need it, in which that means that a majority of overdoses in Canada happen when people are using alone. Minister O'Regan and I have been working with the natural resource sector, the construction industry, to understand that when people are using alone, they are often dying alone, and that this is something where we again know the stigma is the barrier to them seeking help. So we have to put aside the stigma and judgment so that people don't hide their substance use or addiction, and it means that if you're not hiding it, that you're more likely to be able to seek help and take down those fatal overdoses that are just heartbreaking. So today we are pleased that in National Addiction Awareness Week to be able to announce over $15 million in federal funding to an additional 24 projects across Canada. Ces 24 projets financés par le programme sur l'usage de substances et des dépendances de Santé Canada aideront les personnes qui risquent de subir des méfaits liés à l'usage de substances et de surdoses. It's quite clear there are certain governments that don't want us doing this. This is yet it's very interesting amongst my colleagues in Parliament and MP Naqvi is that everybody now knows what SUOP is. Everybody says they are looking for the SUOP projects in their riding. They know that these substance use and addiction program funds are actually saving lives. And it is because of the accessibility, because of peer support, because of the innovation that is different in each part of Canada as to what those frontline organizations and people are designing that would work best in their community and to provide the further support for those affected by addiction, substance use, or who face barriers accessing the services, including women and youth. Since 2017, more than 300 projects across Canada have been funded through SUAP. Ces projets comme ceux dont nous sommes ici pour parler aujourd'hui font une différence dans les communautés ici à Ottawa et partout à travers le pays. We know that, and it is just so great to be here because it's quite clear that Operation Come Home you've got the tools and capacity to meet the unique needs of the people you serve, because they meet people where they are, both physically and mentally, and ensure they get the help they need. And we are very aware, as you are, about the need for housing here in Ottawa and how that has to come together. So we all have a role to play. We all need to be aware of the impact that our words have. Ensemble, nous pouvons aider les Canadiens à recevoir des services de santé et le soutien dont ils ont besoin. It is really important to be here in what is a community of caring in National Addictions Awareness Week, and we ask all Canadians to become part of a community of caring. Thank you. Merci. Miigwech.
Thank you very much, Minister Bennett. My remarks are going to echo a lot of yours. We didn't compare notes in advance, but it's all very, very aligned. Je suis le directeur général de Opération Rentrée au foyer. As Executive Director, it is my pleasure to be part of this announcement during National Addictions Week and share the gratitude from our staff, our volunteers, our clients, everyone involved with Operation Come Home, our volunteers, for the investment and the priority that the Government of Canada is placing on supporting people with substance use and mental health challenges. Opération Rentrée au foyer est un centre d'emploi, d'éducation et de soutien pour les jeunes de 16 ans et plus, sans abri ou à risque. Nos programmes se concentrent sur ce qui est le plus important pour les jeunes et ce qui les encourage à atteindre leurs objectifs. We help youth who are at risk of or experiencing homelessness. We work to prevent them becoming homeless adults. Mental health and addictions issues greatly impact our work. We've been involved in this for a long time. We've received support in the community in the past through Project STEP, which is a community-wide initiative that brings together the school boards, an organization called ONFI and United Way, to support youth who have challenges with substance use. Our work has become considerably harder during the pandemic. The pandemic and COVID-19 has placed a disproportionate amount of stress on people with mental health or substance use challenges. Those stresses have grown in the past year rather than recede. Inflation, rising food costs, rising rent costs, challenges in finding housing, all of that is contributing. And so depression, anxiety, and substance use are growing in Canada, in our community, and certainly among the youth that we serve. Over the last year, we saw a 62% increase in the number of youth in our buildings seeking help for substance use and addiction, or mental health, substance use and addiction support. And I've met young people from all walks of life who are impacted. One of our clients is a former hockey player who started his journey with substance use after receiving an injury. He was prescribed painkillers, he became addicted, and when he was no longer able to continue, he turned to illicit drugs. Another young woman had significant mental health challenges and started her use of opioids in the bedroom of her home in Orleans while her parents were downstairs watching television. The problem is pervasive, and the outcomes are often tragic, as the minister has said. Some of our youth in the last year have passed away due to overdose. And in fact, according to Ottawa Public Health data, there's more overdoses in the Ottawa community than there ever has been before. We need to come together to meet these challenges head on, and so that's why we're so grateful for the hard work of Minister Bennett and all of our colleagues in Health Canada for the announcement made today. With the financial support and some guidance from some excellent staff in the SUAP, we've launched our Street Outreach Project, as you heard, meeting youth where they are and opening up conversations about mental health. We're providing information to youth to keep them safe, and we're helping them find support in the community. Our project was developed by a team of people who have lived or living experience of homelessness and substance use in Ottawa. And it's being delivered every day by people who have firsthand experience of the barriers and the challenges that our youth experience. But it's one thing more than anything else is clear to our team and all the staff that work here at Operation Come Home, is that the youth that we're reaching are not different than any others. They're young people with the same hopes and dreams as any of their peers. To help them realize their goals, we need to put behind us hurtful language, stigmatizing language, like drug addict or crackhead or junkie. The young people that we reach are our children. They're our brothers and our sisters and our friends and our neighbors, and reducing harms from substance use for them means meeting them where they are and recognizing that we can only make progress when we talk to them with compassion and trust and mutual respect. I'm so proud that with the help of the federal government and our outstanding colleagues and partners here in Ottawa, we can do this work, help these youth overcome their challenges, and move on with the rest of their lives. Thank you very much for supporting this important work. And I think
All right, thank you very much. We'll start the question period. If you have a question, please come to the mic and please limit yourself to one question and one follow-up. On va maintenant commencer la période de questions. Si vous avez une question, veuillez venir ici au micro et merci de vous limiter à une question et un suivi. First question from Tessie with the Hill Times.
Hi, thank you for taking my question. Minister Bennett, I'd like to start off talking about one of the areas that many advocates feel would help with the opioid crisis, which is decriminalization. Just wanted an update on the Toronto application, if that's still in play. And it's been more than a year since that was submitted. Also, in the past, you've mentioned other cities that are interested. Can you update us on that at all?
Thanks for the question. And yes, like with the BC application, this was hard work by both officials, both from the province as well as from our department at Health Canada, working together to make sure that all of the kinds of criteria that we need to see for a successful application, things like, are the health and social service supports adequate? If you're going to move people from the criminal justice system into health and social services, those services need to be there. Training for law enforcement, public education. There are a number of things that we are working on with Toronto to move forward. As you know, that was a Board of Health application, and so we are working with Dr. Davila and the Board of Health with Health Canada to work on their application, so in order for it to be successful.
I know it's kind of dangerous to compare very different jurisdictions, right? They're opposite sides of the country. But the BC application was approved within months, like 7 months. And now we're more than a year for Toronto. So why, I understand the idea of the criteria, but why is it taking so long, especially since you seem to have now a standard through the BC approval?
Well, I think that you're quite right, that the BC application and approval is very much informing other jurisdictions who are thinking about being able to go forward. As you, it really is a matter of working together because they are very different and will have different approaches, different drugs, different realities, and it's just, we just have to work together until we get it right.
Thank you. Merci. On va maintenant passer vers le Zoom pour des questions en ligne. We'll now go to Zoom for online questions. Over to you, Natalie, please.
Thank you, Mark. We will now proceed to questions from journalists online with Zoom. If you are a reporter and you wish to ask a question, please use the raise your hand function. We ask that you limit yourself to one question and one follow-up, and unless I have stated it, please indicate your name and media before asking your question. Nous allons maintenant prendre des questions des journalistes sur Zoom. Si vous êtes des journalistes et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et suivi, sauf si je l'ai dit, veuillez indiquer votre nom et votre média avant de poser votre question. Alors, on va commencer avec Jacques Galland. We will start with Jacques Galland from the Toronto Star.
Good morning, Minister. I wanted to ask you about alcohol warning labels. As I'm sure you know, Senator Brazo has a bill about that in the Senate. Lisa Marie Barron has a motion in the House that would basically accomplish the same thing. So I first wanted to ask you, do you think that there should be warning labels on alcohol, warning about things like links to cancer and telling people how much of what a standard drink is? Do you think that such labels are needed?
Well, I think it's really important that we continue to consider everything that could have people understand what is a safe amount of alcohol. And I think what we're seeing certainly from the Canadian Centre on Substance Use and their guidance document that they've released is that it's much lower than people think. And I think that we will work with the experts and the Centre for Substance Use, as well as the provinces and territories and all of the people who know these things to develop a really important plan, particularly as we go to consider what is going forward with Senator Brazo and others. I think people do want to know what they are ingesting, and I think that we have seen that again with some of the challenges that have been there when people aren't aware of how much sugar's in something or how much salt. I think people do want to be making educated decisions on consumption, and I think that there have been changes that Health Canada has made. I think that some of the canned drinks, were much too large a dose, and that they continue to adapt in that way. And we will continue to work to have the best possible policies on alcohol awareness and use.
Thanks, Minister. And I wanted to ask you then, could you just explain then why is it that there are warning labels on cigarettes, for example, but not on alcohol? Like, I think like the Centre for Substance Use, as you mentioned, they've very clearly stated that there is a link between alcohol and at least 7 different types of cancer. So the links between, tobacco and cancer is well established on the warning labels. So why do cigarettes have warning labels, but not alcohol products?
Well, yes, and I think, as you know, Jacques, that now going through the approvals process, now we will be moving to have warning on each individual cigarette, meaning that we are continuing to evolve and to put in place the policies that work and have been demonstrated, and we'll continue to work with the experts to be able to develop the best possible approach to this and make sure that people have what they need. As you know, the signage around drinking and pregnancy, there's other approaches that are evidence-based, and we will continue to work on anything we can do that is evidence-based and where the experts will lead us.
Thank you, Minister. Our next question will be from Mir Rapson.
Oh, sorry, I just finally unmuted myself. I'm wondering if you could explain this morning why you think we are still having a debate about harm reduction and the benefits of harm reduction. You seem to think the evidence is clear. Why is there still a debate, and why are we still not able to move forward without constantly having this discussion?
I find it completely infuriating that the evidence has been there. We've been running managed alcohol programs for a very, very long time. For 40 years, people have had methadone. For almost 20 years, Suboxone, now Sublocade. That the idea that harm reduction and medication-assisted therapy is well understood. I do not understand where the ideology draws a hard line between all of the other approaches that we know are saving lives. When we can reverse 42,000 overdoses since 2017. I don't know what part of the evidence the opponents are ignoring. It's just infuriating. I thought that to have the former advisor to Stephen Harper, Ben Parent, for him to come out yesterday and say that conservative war on drug tropes that have long since been discredited and have been found not only ineffective but costly and deadly. That's I think what the people on the front lines are saying. Just stop with this. And the idea that many provinces are refusing to really acknowledge the importance of harm reduction in other than the things they choose and cherry pick, as opposed to the things that we now know truly are saving lives. And I don't understand it, and I am upset that again that the stereotyping of the downtown east side and a video of down the street behind every one of those doors in the downtown east side is a great organization like this one, with people working every day to help the people, to help them end up living a full life. And I just think that it ignores the fact that so many people are dying home alone because they've been afraid or ashamed to be able to admit their substance use to family and friends. I think that organizations like Mom Stop the Harm, there has to be a way of breaking through. And I think that when people like Ben Parent come out and challenge the leader of the opposition in such a clear way, that this isn't and shouldn't be left and right. This shouldn't be a partisan thing. This is about saving lives. And I think the sooner that they just are shut down on this, and that the people of Canada, and we now have Canadians with us on this. I think that this is really clear, that the kind of understanding that people have about what it will take to save lives, and that we can't have people interfering with that with just false information and stereotyping.
Thank you. I'm also wondering how you reconcile sort of the idea of harm reduction with programs that are more difficult for people who have already had interactions with the criminal justice system. There are rehab programs that won't admit somebody who has been convicted or charged with crimes. It makes it very difficult. How do you reconcile the idea of harm reduction with the fact that some people can't access these programs because they have had interactions with the law?
Well, I think it's unacceptable. I think that quite often, it is about us trying to meet people where they are. It is about us getting pardons for people and so they can get work and get housing and all of those things. But for the people actually delivering services for recovery, to not admit somebody that has, because they've been had an interaction with the criminal justice system, I just don't understand it, and I think that they need to rethink their approach. If as in National Addictions Awareness Week, we're supposed to be creating a community of compassion, that doesn't sound like compassion to me.
Thank you, Minister. That concludes the questions on Zoom, so I'll turn it back to Mark in the room.
Thank you. We're just going to take one more question here from Tessie Sanchi with the Hill Times.
Thanks, Minister, and thanks, Mark. I'll ask about, Minister, your government has really emphasized social determinants of health. Take this organization and look at everything they do, housing support, mental health, the drop-in, et cetera. How has that changed, or how do you feel your government maybe works differently than previous governments in terms of actually talking to each other? So if someone approaches you, the Minister of Mental Health and Associate Minister of Health, do you know housing policy?
Yeah, Minister Hussein and I have talked about that a lot, because I think we were just talking about it, that kids coming out of care, people coming out of prison, how do we develop programs together and I think that certainly with Minister Hussein and the success of the rapid housing policies, where, within 12 months you can get a significant number of people housed. But again, that what we are working on together, and certainly where I am around the country, we know that we need partners in community to be able to make sure those those health and social services are available. So in Saskatoon, in the end of June, when we had that conversation, how do we make sure that Minister Hussein is able to approve a rapid housing application by making sure that the health and social services are there? So I think those are the kinds of things that we are working on. I think a lot of us are very excited by what was in the budget on co-op housing, because it's been, a lot of those co-ops have paid off their mortgage. Now they're ready to do more, and now we are going to be able to go forward in a way to finally get some more built and people into them in that really collaborative approach that I think also has been shown to really work. So I think that I've been very excited really to this whole of government approach that our cabinet and caucus has taken, that whether it was the Truth and Reconciliation calls to action, whether it was missing and murdered Indigenous women and girls, that I've had extraordinarily positive experience knowing that really on both of those things, my department itself couldn't fix these, but by working with all of my colleagues across the whole federal family, that we've been able to go forward. So, I think that, as John said, that on social determinants, it really is poverty, violence, the environment, shelter, equity, education, that we need to be doing all of those things that are about keeping people well, not just patching them up when they get sick. And that's why I think that this whole of government approach, but also working across jurisdictions, and the reason why, for things like SUOP, that we are actually also, working directly with municipalities on this.
Okay, that'll bring to an end our event today. Thanks for being here. C'est la fin de notre événement. Merci beaucoup d'avoir été avec nous.